Good morning and welcome to this week's edition of NCompass Live. I am your host, Krista Burns, here at the Nebraska Library Commission. NCompass Live is the Commission's weekly online event. Yes, you can call us a webinar. We won't be offended. Some people out there might be offended by it, but it's okay. It's what we do. And we do these sessions, NCompass Live, every week, live at 10 a.m. Central Time. All the sessions are recorded, so if you're unable to join us on a Wednesday morning, that's fine. You can go to our website, and we have all of our previous sessions. The recordings are all up there, so you can watch them. The PowerPoint presentations, if there are any, are used, are up there. They're available to you, so everything is collected there for your use afterwards. It's free and open to anyone to watch the live show and the recordings, and we cover anything. Anything library related, we want to put it on the show. We do presentations, mini training sessions, interviews, book reviews, whatever is library related, we want to get it out there. So this morning we are talking about, and you can see here on the screen, the new health insurance. Libraries and the new health insurance marketplace is our official title this morning. And lots of big news has come out about this, so we're going to get into what has come out, what's going on with it. We have myself and a couple of speakers here next to me. You can see this is Mary Sowers. She is our newish Government Information Services librarian here at the Nebraska Library Commission. So she's going to share some information about what is out there for librarians to help them deal with this incoming thing to their libraries. And on the line with us remotely is Kendra Morgan, who is from Web Junction. Hi, Kendra. You can say hi. Hello? Hello. There you go. Okay. No problem. A little delay sometimes.
Hi.
She is joining us remotely. You're from out on the West Coast today, right? Sometimes I'm never sure where you're at. Yes?
Coast.
Yes.
Yeah, I'm based in Seattle.
Yes. In Seattle. So she is going to be telling us about what's going to be available via Web Junction for people. So to get started with this, let me check here. As everyone knows, the new HealthCare.gov website is available, it's out there right now. And as of October 1st, as you can see here, consumers will be able to go there to choose health coverage. This is part of the Affordable Health Care Act that was put into place. And at the American Library Association conference last month, yes, just last month, and it was announced that libraries would be available to help customers and consumers who want to choose their health care. There was an announcement made. It was a little, I think, surprising to some people, to some libraries, the way it was presented, but it was, it's actually a good thing that it was put out there, and I think, personally, getting libraries out in front of people and known as resources for this kind of thing. This is something, so the announcement was made that librarians would be assisting consumers, not just librarians, though that is just one place that people can go, so that's something to also be aware of. You're not on your own out there. And that there would be training and resources and things put out available for librarians to help them get up to speed with what is out there and what they can be doing between now and October 1st. And that's what we're going to get into some here. HealthCare.gov is the web page that patrons will go to when they come into your library. As far as what librarians will do, it's just as with everything else that you do, you are not going to be required to give people advice, tell them what they should choose, that kind of thing. Patrons have been coming, people have been coming into your libraries for years asking for help on filling out their tax forms, filling out their unemployment benefits, other things like that are very private information. You have helped them with those over the years. This is the same thing, just another thing that they will be needing assistance in being guided to, pointing them to the right page to go to, giving them maybe handouts or the right resources that are out there for them. So it is a huge change to people in the country as far as healthcare. To us as librarians, I think it's just another thing that we've always been doing and that we'll continue doing with offering them, directing them in the right place. There will be people, I'm not sure we're going to talk about the navigators and those kind of things. Okay. There will be official people who are trained and are go through certifications and official trainings about actually giving advice to consumers out there. And Mary's going to expound a little bit more on that. And that's the kind of people that you will be able, as librarians, to refer them to. This is, someone comes in and says, I don't even know what to do, tell me what to do, and you say, shh, I can direct you to the right place. So there's going to be, I think that takes a little bit of the fear out of it, for me at least it did. Absolutely. As far as we do not have to, as librarians, understand what's the best healthcare choice for some particular person who comes in. They are training people to actually do that.
Although by the time you're done with it, you'll know a lot more than you ever wanted to.
So. Yeah, which is kind of common. That's yes, you learn what it's the same questions come in over and over about how do I do this thing with my taxes and whatnot, and you can eventually rattle it right off the top of your head. Yes.
Yeah, you learn the lingo fairly quickly, when you get the same patrons or get patrons coming in asking the same questions all the time.
Right. So that's the basics of what's going on here. We're not going to get much today into the HealthCare Act itself and what's available and what people can do. That's going to be something that is going to be coming out from the government and from some sites we've been mentioning here. We're mainly here this morning to tell you about what librarians are going to be doing, and resources that are out there to help you, things that are being planned. Some stuff is already available, some things are in the works. So that's mainly what we're going to be talking about today, are those kind of resources, not the HealthCare Act itself and what people can pick and choose. That's something that all these resources we give you, you'll be able to start kind of filtering through. And like I said, as we've done with all the kind of things that people come into our libraries for, sending them in the right direction. Yesterday or the day before, I forget, there was a letter announcement put out by ALA that I thought was worded very well, and of course I probably can't find it here, but we know that the patrons are going to come to us for help, whether we want them to or not, whether we officially tell them, come to us and promote it, whether they even hear about these things that we heard that librarians will be a first line of defense in helping these people. We know they're going to come in anyways. So the point of this and the training that's being put together and the resources is we might as well be prepared ahead of time instead of shocked and surprised when October 1st comes around. They're going to come in anyways, so let's get ourselves up to speed on this before the deluge comes in.
Yes, absolutely.
So I think that's a pretty good basics, and I think we'll switch over to Kendra. I'm going to have you pick up next and tell us what's been going on with what Web Junction is doing. I know that was something that was mentioned a lot in the announcements and everything.
Yeah, thank you.
Yep, I'm going to give you control here so you can share your screen. Hold on just a sec here. Okay, you should be seeing a pop-up for you to share your screen. There we go. Yep, we see it. Looks good.
Perfect. So as Krista mentioned, my name is Kendra Morgan, and I work on the team here at Web Junction, which is part of OCLC. And at ALA at the end of June, June 30th, I was participated on a panel along with Susan Hildreth, the director of IMLS, and the Centers for Medicaid and Medicare Services. Jackie Garner was there as well as a representative from the National Networks of Libraries of Medicine, to talk a little bit about everything that's happening around the Affordable Care Act and what was being done to help libraries prepare for that a little bit more. And that was part of the announcement to let folks know that we are in the process of creating resources and materials that can help libraries with some of the questions that they're going to see come through the door as we get closer to the launch of the enrollment start date, which is October 1st. And so IMLS, which is the federal funder for museums and libraries in the country, saw a need to really start addressing this in advance of the launch, and so they've pulled, we've been working together on this cooperative agreement with them, and they have also partnered with CMS to look at how to disseminate information to libraries and get them tools and resources that will help with serving patrons. And so a little bit about what's going to be happening at Web Junction and in terms of supporting these needs is we are going to work both with public and state libraries in the collection of resources and materials that can help library staff to help patrons with questions that come in about the ACA. We know a lot of great work is actually already underway, and so we're going to try and capture some of these stories and use them as examples of how libraries may choose to work with patrons locally. And I think one of the things that Krista mentioned early on is that every library has to decide locally what level of involvement they can commit to. Every librarian, if someone comes in and says, where am I supposed to go to do X, it doesn't matter what the question is generally going to get patrons to the right place, and this is no different from that. What they may start seeing are different types of requests, like, can you help me complete this form? How do I know which plan I should sign up for? And that's where the library staff is going to have to look at their options in terms of connecting patrons to a deeper level of resources. And one of the things that will be available through another program through the CMS is called the Navigators and Assisters, and these are going to be people in every state that are trained and qualified to help people look at their options. So one potential opportunity for libraries will be to partner with those organizations to maybe offer one-on-one training sessions in the library or scheduled group informational sessions, and all of those details are still pending. We don't know exactly what those programs will look like, but part of the key role that we want to make sure we play with those groups is to encourage them to reach out to libraries as potential partners. A lot of libraries have meeting room space, they have laptop labs, dedicated computer space areas that could be a perfect community resource for some of these opportunities for people to learn more about the coverage options that become available to them on October 1st. So it's kind of working both ways. We'd like to look for ways to make sure that people working on this project know about the strength of libraries and how they might be able to partner with libraries, and for libraries to look for those opportunities as well. So that's one piece of it. And we're also working with an organization called Zero Divide, based out of California, and for over 15 years they have been working with technology in underserved communities to help improve outcomes in areas such as health or education, civic engagement, and workforce. So a lot of things related to digital inclusion, and they are going to be e-health subject matter experts in this work and helping with the development of resources that can be used by state and local libraries to determine how to engage. So we are looking now at collecting information about what will be most valuable for libraries to have for these types of tools to be developed. So we were just down there in San Francisco meeting with their team on Thursday and Friday, which was great because this project really just launched on July 1st. So we're really excited about the work ahead, and we know people are very interested and eager to learn more. Let's see. The page that's up right now that's showing on my screen is the new eHealth section on Web Junction. And so this is going to be where we start storing information about the project, and so there's just some basic facts about the agreement that we currently have with IMLS. We also have some frequently asked questions. One of the things that we heard a lot about, what's available now, and there actually is a lot of great information available both on HealthCare.gov, which is the public-facing site. That's where people will actually apply for coverage on October 1st for those libraries or for those states that are participating in the federal exchange, which is the case in Nebraska. And then there's also information, there's training resources that are available on marketplace.cms.gov, and this is an opportunity, and again this is an individual choice, but if you want to learn more and dig in a little deeper to some of the information about the Affordable Care Act and how it might impact people, there are training materials available for trainers to use that information. So we have started keeping track of these questions, and some of these came up at the ALA conference in June, and we'll keep adding to them as we have more information available. And one of the important things to understand is we're going to be talking a lot about October 1st, and that is the first day of open enrollment period. And anyone who wants to receive health coverage by January 1st will need to submit their application by December 15th. So there could be more activity around that time, but they really don't know. So it's a little up in the air how many people are going to be walking through the doors or what kind of impact you might see, but the window is actually October 1st through the December 15th for January 1st coverage, and the enrollment period stays open until March 31st. And there are more information about this project or about the timeline available on the HealthCare.gov site if you're interested in learning more about that timeline. In addition to being able to learn more through this site, we're also collecting questions if people have them, as well as an email address and contact information. If you want to be notified when new resources are added to WebJunction, you can complete this form, as well as if you have any questions. So questions that we receive through here are also going to be part of the FAQs that I just demonstrated as an opportunity to share. If we see enough of that question, we'll try and answer them and keep them up to date on the eHealth page. And this is that HealthCare.gov site, it's really helpful. It has a lot of really good information available. They have a glossary of terms if something's not familiar to you, and you can also sign up for updates through HealthCare.gov if you would like as well. And right now, if you go to WebJunction, the eHealth page, such as webjunction.org, is under the hot content there on the right, so you can have quick access to it. So Krista, that's about most of the information I have. Are there any questions that I can answer or things that would be helpful to clarify?
Great. No, thanks, Kendra. Actually, I believe you're going to be can you talk about the webinar you're going to be doing later this month?
I can.
Anyone? Yeah, just to let people know that that's coming.
So on July 26th, there is a webinar which is filling up very quickly, as in I think it will be full by noon today. Oh, okay. It's unprecedented interest, which is actually really exciting, that people are really interested in learning more. But it is also available on WebJunction under the upcoming events, libraries and health insurance. So that's on the 26th at 11 a.m. Central. If you can't attend that day or registration close, we are going to create an archive that will be freely available within 4 hours of the day of the session. So it'll be up that afternoon, and that will include the same panelists that participated in the ALA session, and most of the similar content and a few additional updates, of things that have changed since we presented at the end of June. But we will look to schedule things moving forward that allow for some regular updates and sharing of tools and resources.
Great. Yeah, that's what I wanted to make sure, because I know a lot of people, not everyone is able to make it to the ALA session, and while it was happening, I saw tweets and things on Facebook coming out from people who were there, but also from people saying, what are they saying? What are they saying?
Yes, so we're really happy to be able to do it again. And like I said, the archive will be available. Sometimes, people can't get away from the desk at any particular time, so the archive is always a great option to go back and review. And we will take the questions from that session and answer as many as we can during the Q&A period, and then anything else we'll try to get through follow-up on the website.
Great. Okay, cool. That's awesome. Yeah. I think the stuff that WebJunction has put together here is really good. I've looked through some of it, a lot of very useful explanations of things, and since knowing that you are the ones that are connected with the IMLS and ALA deal, knowing this is a place to go for that kind of librarian-specific resources and information is really good. And what Mary's going to show us something that's not librarian specific, it's professional assister specific, I guess.
Yes.
And specific Nebraska. So thanks so much, Kendra. I'll just stay on the line in case we have any questions or things as near the end.
Can do, yep.
Cool, all right. I am going to pull back control here to us so that... Yes, we are. All right, and I'm going to hand over to you, Mary. You can take over.
Thank you, Krista.
You all set? Yep.
And good morning, everyone. I just wanted to say welcome, and hopefully some of the information that I'm going to give you today will help you, if anything, become more familiar with the websites that are available now, so that when you do start to get questions from consumers and patrons about the insurance, the health insurance marketplace, that you will be able to be very comfortable and a little bit maybe ahead of the game in pointing them to where they need to go. So this health insurance marketplace is actually the official logo, so you're going to be seeing that a lot in the coming months. But what I've put together here is just a really quick reference guide, first of all, with what I consider, especially for Nebraska, the 3 websites that you're going to need right away. And then for everybody in the country, the first 2 websites, marketplace.cms.gov and HealthCare.gov. Those 2 are for everybody, and that's those are probably the 2 that everyone is going to need to be the most comfortable with. And I'm going to go through each of these one by one to navigate a little bit through them, point some things out so that you'll know where to go very quickly when someone asks, or show people the websites and kind of demonstrate what they need to do once they get on. This is not necessarily you need to do this for them, but you need to get them pointed in the right direction, and then they can take it from there. The first one I want to talk about is marketplace.cms.gov. That's the Center for Medicare and Medicaid Services.gov. And I am going to, there it is.
Up a new one. I messed up Mary's organization by popping up a new tab.
And that's quite all right. Not a problem. Believe me, I did a whole bunch more than that when I was putting all this together. So this is the what I consider the professional website that librarians and professionals will need to go. And professionals, I mean also some like agents and navigators might find this website interesting as well. And of course later agents and navigators are going to have a little bit more in-depth information on their end. But to begin with, this is not a bad place to start. But for librarians especially, this is the one that I consider more professional. And there are 3 main categories. The first one is Partner with Us, and this is, like Kendra mentioned before, ways that and suggestions for the ways libraries can partner with your community organizations. Maybe you have some organizations who are becoming navigators and counselors. And so maybe you can work with them, get suggestions for how you can work with them to create programs for the organizations to come speak, or maybe like during tax season here in Lincoln at the public libraries, we have an organization that comes and actually helps people fill out their tax form for free. So this might be a way for you to set up a program like that with someone in your community. Okay. The next one is Get Training. This one is actual training materials like presenter slides, video presentations, Spanish language version, video presentations and presentations themselves. And also too, down here at the under related links, and this is also in news, if you look up news on this website, there is a health insurance marketplace training schedule for a Marketplace 101. So if you're not familiar with how this overview picture works and you don't have a really good grasp of it, this is a great place to get that. Krista and I sat in.
We attended the one that was just the last one on July 9th, and it was very good. It if you're wondering what's up with the HealthCare Act and what is really available and what's going on with that, the stuff that I said in the beginning we are not covering today, this is the thing to attend. It's a 1-hour webinar, and it was very, very useful.
Yes, it was. It gave us lots of ideas as to where we needed to go to, try to start pulling together some information.
And they do accept questions and things during it as well. It's not just a talk at you and that's it presentation. Correct. They were accepting questions from us as librarians, wanting to know what are we supposed to be doing, what can and can't we do. So it's a back and forth type thing, so definitely very useful.
And without going into too much detail, one of the questions that we had very specifically that they did finally answer at the end was, are librarians expected to be navigators and or counselors for the consumer patron?
Right. Are they required to be trained or certified to do this?
That's correct. And the answer is no. Nope. Librarians really are doing what we do anyway, and that is to guide people to the right information, not advise them. So librarians are not expected to be certified navigators or counselors. So that was the one specific question that we had, but this webinar in general is very good for an excellent overview of how the whole program is going to work. So I'm going to go back now to the Marketplace, CMS Marketplace, and this Get Official Resources is actually the most important section of this whole website, because this is where there are lots and lots of publications, articles, research, some multimedia ideas for you, widgets and badges that you can use in publications, logos and graphics that you can use in publications, Spanish materials, other languages that are available, and there are actually quite a few other languages that are going to be available so that everyone's needs are served, and then other partner resources. So one thing I wanted to point out under publications and articles is that there are actual brochures out here that you can pull up and print off for your patrons and people coming in asking questions. And of course, this one is not going to come up right away.
It'll get there eventually.
Yeah, eventually. Let me try just doing that one again. Now, normally these just pop right up. But these are being a little slow today. But anyway, they are brochures that you can pull up and print out and have ready for your patrons. And there are also fact sheets. Like, for example, this first one is key dates for the health insurance marketplace. Again, this is something that it's a one page that you can print off to have on your reference desk or on your circulation desk as people walk by. If you have an information table, you can put this out. You can put all of these things out on your information table or your little brochure slots, along with the bus schedules. Things like what happens when. Like, for example, here in July. Well, actually back in June, the marketplace was open for business for people to call. And this month in July, you can begin to set up an account. And you can also sign up for email so that you can get updates to the marketplace and to new things that are happening. Things aren't happening daily, but I have found that things are being put out weekly. Announcements are being made weekly as to documents and things that are available that weren't available the week before. So this is just an example of a fact sheet that you can print off for your patrons. Again, and another fact sheet, and you could either put these all together or have them out at specific individually so that people can, if they if they're not interested in the timeline sheet specifically, they can go to things to think about when choosing health plan. They can get a little bit more specific. So these are just ideas for you to use in how you want to present information to your patrons. Lots of other fact sheets for you to choose from. I won't go through all of them. They have examples of what the consumer applications are going to look like for the healthcare, and these are only to be looked at right now. You cannot actually submit an application until October 1st, but every piece of information that I've come across says try to do as much of this in advance. So if your consumer or your consumers and your patrons want to know, what can I do now? Point them to things like the applications and the things to think about, and because there will be specific pieces of information that they will need to sign up. So
it's like collecting all your receipts and everything to prepare for doing your taxes.
Yes,
every
absolutely.
year. You can't just necessarily jump in and start filling out your tax forms. You've got to
you have to
gather
have
stuff, resources, and information ahead of time.
Yes, you will need names, birthdays. Like if you're an individual, you'll need your name and social security number, and your employers and your employer history. If you have a family, though, you'll need every person's names, birthdays, social security numbers, and if they're of work age, then you'll need all of their employer information as well. So do point them to, what can I do now to prepare for doing an application. Now, I want to go back to my slide here just to do a quick overview. The marketplace through CMS is generally for professionals. It does include partners. Not a lot of information there yet as to specifics about navigators and counselors for state, but there is a sample application out there under partners for how navigators or how people or organizations who want to become navigators and counselors can apply for that. Now, in most states, from what I can tell, most states already have this process going, and they have granted they are accepting applications from people, but not everybody has them listed out there. There are training presentations, like I mentioned before, overview, training 101 that we showed you, SHOP, which is the business owners healthcare plan.
Now,
and
going back to the partners thing, I think I'd seen somewhere. Now, as we said, librarians are not required to be trained, certified, or anything. You're going to be doing your usual job as you always have, of just leading to the right place.
Yes.
But if you, as an individual, wanted to become one of those
yes,
counselors, you could, separate from your job as being a librarian at your library, yes, go and figure out how you can possibly, if that's something you're interested in, apply and go through the training to be certified to do that.
Yes, that is absolutely right. So if your library is wanted to have an in-house person, so to speak, to come in, say, after hours, and you have a particular interest in this, yes, an individual could train and apply to.
That's like what Kendra was saying. Each library you're going to get be involved in this whole process.
That is absolutely correct. Right. I've shown you some basic of the official resources, brochures, fact sheets, articles that you can read about this whole process of the Affordable Care Act and the federal health care and how the whole program is going to work. There is a frequently asked questions here at the top, and that takes you to this page and gives you a little bit more in-depth answers as to what are health insurance marketplaces, also known as exchanges. So you're going to hear that a lot. And how do consumers apply, and premiums, when, so timeline, things like that. So frequently asked questions is another place that you can go, and that you can also direct patrons to go. You can also sign up and join the various groups. You can sign up for email. And let me see if I can, it says get the latest partner news, or if you want official resources, and actually the partner and the training and the resources all point back to this same sign up for email. So anything that new that shows up on this website, if you've typed in your email address here and submitted it, you will get the latest update. And I have not actually done it with this website. However, I did do it with the next one that I'm going to talk about, but in HealthCare.gov. But again, you can sign up with email. They also have Facebook, Twitter, and YouTube. So you can stay up to date with the very latest. And the next one that I want to go to is HealthCare.gov, and I went backwards. This is the quick reference page, the CMS Marketplace. HealthCare.gov is the general website. They have a 1-800 number that people can call now, and for the hearing disabled number that you can give out as well. So far as a phone call, this organization is up and running right now. Okay, so let me go back to, and then this is the website, HealthCare.gov, and it is divided into individuals and families, where you can investigate your options and ask questions. There is a live chat going on at all times. It is also available in Spanish. So people have options right off the bat. There is a very small little YouTube video about, I want to say it's about it's about 2 minutes, just under 2 minutes, for some basic instruction. There is also a small businesses. And again, it's the same type of format, see your options, live chat, and you can, again, on all of these, you can do Twitter, Facebook, email, and if there's anything that you want to print out, you can do that. It is also available in Spanish. So there is an all topics, so when you just scroll over that, you can pick and choose the topics that you want, and this is probably going to be the website that you will use the most. Once you get yourself oriented through the CMS Marketplace, this is the website that you are going to use the most with your patrons, because this is where they will need to be to sign up for insurance. So going back to the main HealthCare.gov, if you do Start Now, it will give you some options. Like if, for example, you want to find out what types of insurance might be available to you, you can go through a series of questions and get some ideas as a consumer as to what plans are available, what your costs might be, and options on how to get one or the other or both. Yeah, so go back to this one. And like I said earlier, the CMS Marketplace is for the professional, more or less. The HealthCare.gov is for consumers to learn about and buy insurance. This will connect consumers with the correct exchange or the correct marketplace for their state. Now, for example, Nebraska consumers will enroll through HealthCare.gov. And I want to be sure and show you that from the main web page, if you scroll down, right in the middle, there are 3 questions. What is the health insurance marketplace? Basic explanation of how the whole program works. The next one is, what is the marketplace in my state? And if you click on that and then scroll down and select your state, like for example, Nebraska, it tells you point blank, if you live in Nebraska, you'll use this website, healthcare.gov, to apply for coverage. Okay. And then it will say, learn more about the marketplace and how you can get ready. That'll be the next step, for a consumer. Now, what I did just as an example, because I kind of knew who some of our attendees were going to be here this morning, I also checked out Virginia to find out what their exchange would be. They are also using HealthCare.gov. I looked up New York, and partly because we have an attendee and partly because my husband's from there.
That's where we're all from.
Yeah, Krista's from there too. And it says if you live in New York, the New York Health Benefit Exchange is the healthcare marketplace that will serve you. And then it gives a link. Visit the New York Health Benefit Exchange now.
So then in that case, New York is hosting their own.
Yes, that is correct.
That's an example.
Yes, New York is hosting their own, and they will. They have some basics, pretty much similar to the HealthCare.gov. What is an exchange? Information, news to keep you updated as to what's new, what's latest and greatest, and then how to go about signing up. So. The other one, just out of curiosity, I did look up Colorado, having come from there, just a few years ago. They are also hosting their own exchange. So again, they give the link to that, and then once they get to that particular link, it walks them through what they need to do.
So that's great. So people don't have to search around and figure out from their own state. You can go to the main website, yes. HealthCare.gov, and then it will lead you to whatever your local.
That's correct. And that's probably 9 times out of 10 what libraries are going to be doing all over the country is going here and pointing them using this as a general overview and then pointing them in the right direction as to where they actually need to go to apply. Now, for Nebraska specific, I wanted to touch on the Department of Insurance. In doing lots of looking, trying to find information for librarians here in Nebraska, I checked with both the Department of Health and Human Services here in Lincoln and also the Department of Insurance. The Department of Health and Human Services so far does not have anything out on its website, and when I called, absolutely has no plans yet, at least that they're not announcing yet, to put anything out on their website. They are referring us to Department of Insurance, so if you have something specific to ask that you cannot find an answer either online or through one of the specific marketplace websites, then the Department of Insurance would be the way to go, at least as a starting point. And I have listed their telephone number here and also too on the first page where I had all 3 websites just as a quick reference. Now, the Department of Insurance website does have some information. It tends to be more technical and more document-based. It is also, I think, intended to be more for navigators, agents, and insurance providers. But a lot of the pages are still under construction, especially navigator and agent pages actually say this page is still under construction. When I called them about this, they said they do not have a list of navigators or agents or counselors for the state of Nebraska yet. They don't have a time specific where they will have that ready and out there on the website, but it will be there by October 1st. And I did ask specifically, you don't have it now, but will it be there by October 1st? And she said absolutely. So, she also referred me back to HealthCare.gov. And so until the states actually get completely up to speed with their navigators and counselors for their states, they are referring everything back to HealthCare.gov. And at the moment, that's probably an okay thing just because there is so much more to do to provide information. It's just not available yet. So. I did, like I mentioned earlier, called DHS, the Health and Human Services. They referred me to Department of Insurance and also, again, back to HealthCare.gov. And The Department of Insurance, I would also want to mention that if you have a patron come in or call that actually is like from an organization that is interested in being a navigator or counselor, I would first of all refer them to the Nebraska Department of Insurance or whichever state that you're in. If that information's not already out there, I would refer them back to the Department of Insurance for your state, because they will have the guidelines that and the applications that the navigators need. So, and this is just a really quick look at the Nebraska Department of Insurance. It's really kind of an interestingly set up site. This is the main page, and it's not readily noticeable when you go to the main DOI page. So if you were to do doi.nebraska.gov or just in a search put in ACA, then this web page will come up for the federal healthcare law. It has consumers, agents and navigators, which is not complete yet, companies, and then marketplace individuals and small business. When you click on consumers and healthcare providers and then back to the left for Affordable Care Act information, it comes up with a list of articles to read. If you click on that same button at the top for consumers, but then come down to federally facilitated marketplace, it comes up with a different list of items that are specifically about the federally facilitated marketplace. So, go back and forth, play with it a little bit, find out what information is there, but I definitely wanted to give you kind of a heads up as to what information is out there and help you navigate, at least have you look at what it looks like now and be able to navigate it a little more easily rather than if you've got somebody standing in front of you and you're trying to learn how to do this. So, there is one other thing that I wanted to mention, and this is, I actually signed up for emails from HealthCare.gov. This was the letter that I got in my email welcoming me to the health insurance, and again, it's a quick reference for the consumer, points them to the website, what they can do to get ready now, answers a few questions, have them follow on Facebook and Twitter, and then also there are specific videos that this particular email points them to. And the CMS marketplace does very similar things. Yeah, so.
Yeah, I signed up for that too, and almost every week I've been getting something, so they're being very proactive, which I think is good. This is with consumers, with here's something coming up, here's something to think about, here's some more information about something or other.
One other thing I wanted to tell you that I think most libraries are going to probably find, and unfortunately, because all the states are not up and running with their navigator and counselors list, I wanted to use as an example New York, because they do have theirs up and running, and I think this is what most states are going to look like in some form or other eventually, as to the type of list that people are going to be able to refer to as far as organizations that are available. And where is it? Shoot. Okay, I apologize. Yeah. They actually have a map of all of the navigators by county, and then when you click on the county, and I believe it might be under available here. If you click on the county, it lists in New York, say for example Monroe County, there are 2 organizations that are available. Yeah, I'm not finding it, but New York was a good example of where they already have a navigator list out there and a counselor list out there. There were 2 organizations in this particular county that I looked up that are already on board and ready to help the consumer. So,
well, that makes sense since they already have their own website, and they
yes,
obviously decided when this act was first put into place that we're going to do our own thing. Let's get going with this.
Yes,
so
that's
maybe
correct.
They probably started a couple of years ago.
Yes, they may have
themselves organized.
That's true.
Yeah.
But those are some of the basics to get people started, so far as working around the website and getting comfortable with them, so that when patrons come in or call with questions, they'll know where to point them.
Yeah. There's one other resource that I didn't come across. I was told about. If you may have noticed, the people who are speaking or spoke at the ALA webinar, one person, Ruth Holst, is from the National Network Libraries of Medicines for the upper Midwest. She's based out of Chicago, and she's going to be speaking again on the one that Web Junction is doing. So I contacted our local person from the National Network Libraries of Medicine, which is Marty McGee, which some of you may know her. She's at the McGugan Library up in Omaha, to see, okay, what do you got going, Marty? And she's like, we don't know yet, but she says, we're working on stuff, it's coming, don't worry about it. But what she did say was, and this is something you can look up here, if you go to Medline Plus, which is a resource that they refer to people to a lot, because it's from the National Libraries of Medicine, and do a search on, once you get there, there's Medline Plus, on Affordable Care Act. Then they've collected all of their resources that they have right now, so on anything that's going on with it. So if you scroll down, you can see there's some results there. There's kind of a little explanation at first, and then over 1,000 different resources. But this is what, for the National Libraries of Medicine, they're directing people to for now, she said, was we've got this information up there. There may be more coming. We're still working on it, but this is another resource that you can use that's being specifically put together for anyone out there. And Midline Plus just out there publicly for everyone to use. So you can use it. You can send your users to it. Yeah. So, and maybe we'll get more information from Marty later.
Yes, information is definitely coming. And Kendra touched on this, and Krista as well, but it's just that, they've been working on this for a while, and then a lot of the states didn't decide one way or the other whether they wanted to host their own exchange, and the deadline for that was extended, and so now they're the ones who have decided to be their own exchange are having to kind of play catch up a little bit, and then the ones who are not going to host their own are developing materials to point everybody back to HealthCare.gov.
Yeah.
So, but more information is coming, like I said earlier, almost on a weekly basis.
Yes, things have changed since we started looking at this last week.
Exactly. Yes. In fact, the HealthCare.gov website changed literally overnight. Yes, it did.
And as Kendra said, they did this session at ALA, and now the one they're doing this month is going to have new stuff in it because new information has already come out.
Yes.
So we knew this was coming. The Healthcare Act, October 1st is the big date. The announcement was made at ALA, and we decided here at the Library Commission we wanted to get something out right away, at least to let our librarians know, here's what's out there, here's what's coming, here's what you can use right now to get get a head start on it. So we didn't want to wait until September, October. So
exactly.
We jumped right on this and got some data. So that's why we do have some good information, some things to come. But yeah. So anything else?
I think that's it.
Okay. All right. Does anybody have any questions? Nothing came in while we were all talking, which I never know if that's good or bad. We're so good, there's nothing to ask, or nobody knows what to ask. So if you have any questions or comments, type them into the questions section of the interface, and I will mention them. Kendra, do you have anything else while we're waiting to see if anybody has any questions? Anything else you wanted to add?
No, I think this is great. I'll have to use some of these tips to update Web Junction.
Not a problem. We're happy to have you do it.
Well, and while we're waiting for any questions, just to let you know, I am the government documents librarian here at the Library Commission, and if you go to our website, I'm listed in the directory. If you ever have any questions, feel free to give me a call anytime, and if I don't know the answer, I'll certainly find out for you or point you in the right direction to the person who does. So feel free to call the commission anytime.
And for other states, I know we have people that watch our show from across the country. I have heard other librarians have saying various things that I think my state library is working on something. I've heard there's going to be a webinar coming out.
That is
so check and see what's being done in your state for your local. Like, we talked about what's going on here specifically for Nebraska, the Department of Insurance here, what we know, our details.
Right.
Check in with your state library or
your state Department of Insurance
and see if they've got some training or resources coming that they're working on getting out there that is specific to you guys.
Yeah.
Well, it doesn't look like any questions came in, so I'm going to say we did an awesome job. Yeah. Or we scared them into silence. I don't know.
Yeah, it's really not scary. No. At first, it seemed like it might be, but once you really get out there and start looking, there's lots of stuff to look at, and it's easy to navigate. I will say that much. It is relatively easy to navigate.
Yeah, it seems like there's a lot of information out there, which sometimes is a bad thing.
Yes,
too much.
Correct.
But it's good to get this a demo from you of where to go to find all the information.
Yeah, certainly for the basics.
I think for some people in the libraries, they were scared that the whole part about how am I supposed to tell a person what to do? And just as I said in the beginning, something to be very aware of, just think back to what you do with anything. You don't give someone legal advice. You don't give someone personal advice on how to do their taxes.
Right.
You direct them in the right place. That's what librarians do. And we know this. It's in our blood. We know how to do it right. And it's the same thing again here. Just a new thing that people are going to be coming in and asking about.
Right.
Do have a comment here from Dave Mixdorf up at South Sioux City Public Library. Hi, Dave. And this is true that we have seen some of this discussion, some controversy. There are groups, people out there who are just in general opposed to the Affordable Health Care Act in general and are complaining that libraries are being involved, that ALA librarians are pushing this, have chosen to support this, and they don't support it, so they're against your library now. That's just something to be prepared for. As Dave says, it's just like anything. As librarians, we don't control the laws. We just provide access to the resources. I'm sure you've had controversial things to deal with in your library in the past.
Oh yes, absolutely.
So just do be aware, and I'm sure many people do know that not every single person in the country is on board with the Affordable Health Care Act. That you may have to deal with that kind of issue from some of the people that come into your library.
And as a former frontline circulation desk person in a public library, when someone came up and said something to that effect to me, my answer was, I'm not here to disagree or to agree that it is public information. My job is to provide the information if asked. So, and point them in the right direction.
Yeah, good answer.
Yeah.
Absolutely. Yeah. So anything else out there from the audience? Questions, comments, ideas, thoughts on what you're doing? It is all very new to all of us, so we're all just getting going with it, I'm sure.
Yeah. And we're going to be hearing about it a lot more in the few months to come.
All right. Nothing urgent has come in. I think we will wrap it up for today. Thank you very much, Kendra, for being on the show.
Thank you. I appreciate the opportunity.
Yeah, I'm sorry. Apologies to everyone for the little technical difficulties we had this morning. We started a little late, but I think we did pretty well getting caught up and getting everything done here. Got some thank yous coming in. Thank you for the information on the chat here. You just type in NCompass Live, I can get this set up. So thank you everyone very much for attending this morning. The show was recorded, so the recording will be available later today, whenever it gets processed. I have Mary's PowerPoint, and I have all the links and the websites that were mentioned, the WebJunction links, the things that Mary shared, have been collected into our Delicious account, so they will also be available when the recording goes up as well. So that will wrap it up for today. I hope you'll join us next week when our topic will be the new Digital Public Library of America, a new resource for our communities. This is a new resource that was launched a couple of months ago. I forget exactly, was it March? Sorry. And where it can collect links to digital resources that are out there in libraries all over the country. And Jamie Hollier, who is on the director, one of the board of directors of the Digital Public Library of America is going to be joining us to talk about this and what's going on with that. So hope you'll sign up and join us for that next week. Also, NCompass Live is on Facebook, so if you are a Facebook user, please do feel free to go over there and like our page. We post announcements when our sessions are available, when we've added new things to the show, to the schedule. I remind people every Wednesday morning that the show is starting and they can join in when they want to. We do have, you can register ahead of time to join our show, or you can just join us on the fly Wednesday mornings. We post up the login information. So, and when recordings are available, we'll post it there as well. So if you're a big Facebook user, please go ahead and like us on Facebook. Other than that, I think we are wrapped up for this morning. Thank you much, Mary, and
thank you,
Kendra, and everyone for attending. Thank you, and we will see you next time. Bye-bye.